Good afternoon. My name is Marilu Nunez Palomino, and I want to say thank you for coming and for joining us in the first Panoramas virtual roundtable here. And we hope that this information can help you to have so much thoughts about what is happening in Latin America and the Caribbean countries in this time of pandemic. Please let me know if you have any issue to see the presentation, or if you have any comments and questions. Please, after the presentation, we can discuss better this topic. Well, I would like to start to point out that we are living an unusual situation in the world. We are suffering from COVID-19. It was unexpected. It's a new virus, so we know a little about that. And it is affecting the global community, including Latin America and the Caribbean countries. For many of us, it's common right now to enter to the news in the morning and see some information about the spread of the virus. Well, we will present Latin America and the Caribbean countries, risk in times of pandemic. And as I said before, we are living a different context right now in the world and in Latin America. And it is common right now to wake up in the morning and see some news about what is happening, like the number of cases in the world, and also how the COVID-19 is affecting countries in Latin America and the Caribbean. It is common to wake up and see news about the lack of capabilities in infrastructure in the health sector, and also the lack of resources, and from the most simple of the most sophisticated of the medical supplies that the doctors in these countries need to face the COVID-19. So in this context, what we are seeing in Latin America, most part of the countries are taking or are putting in place some policies to face the virus. What are the main goal of these policies? We see that they are trying to flatten the curve, which means trying to implement some policies to try to stop the spread of the virus by social distances, quarantines, some economic aid for the most vulnerable people, for the poor, and also thinking about the future, about after the COVID-19, trying to implement some feasible economic packages, like in Peru, Brazil, and Chile. But as in any norm, there are some outliers in this context. For instance, Nicaragua, where the president is not so much a believer about the consequence of COVID-19 and how this virus can change the dynamic of the national economy in this country, particularly. But what is one of the weaknesses, or what is something that really need to understand these governments? That we know so little about the virus, which means we don't know how we can face this virus in a way that will be 100% of success. So, for instance, we don't know exactly what is the death rate of this virus. We don't know exactly how COVID-19 can create or can spread in different regions of the country that are most vulnerable. We don't know the collateral effects of this virus in the population that is affected right now, and how this population will be also a problem for the health system in the future. And we are talking about a period of time of 1 to 3 years. Now we don't know the time of recovery, and how these people that recover from this virus also are potential to infect again a new population. In this context, it's really important to think about that policies in these Latin American and Caribbean countries need to be so flexible. We don't know, or we live in a moment of uncertainty. So when we do, or we plan about the budget, it needs to be so much flexible. And also we need to think about not traditional policies to face this new global situation. So what we can do in Latin America and the Caribbean countries. Governments have two options. Or they can think that the virus is really dangerous and act to try to prevent the spread and try to take policies that target the spread of the virus and also try to create new capabilities to treat these people that is infected. Or they can simply relax and say that this virus is nothing more than a seasonal flu. So it's a virus, it's normal, it will be passed, people will create new antibodies, and it's okay. But we need to think about COVID-19 like the global warming. So if we don't do something right now and think that it doesn't exist, probably the risk that people will pay in the future will be high. So we don't know exactly what is COVID-19, what implies for the economy, what implies for the people. So we need to take action right now to prevent the spread of the virus and create capabilities to be better prepared to treat people that is suffering from this disease. We see, for instance, that countries in Latin America and the Caribbean country are starting to think about the economics of their countries and how the virus can really significate an important part of the revenues. For instance, Peru is thinking about some plans to use close to 12% of its GDP to face this epidemic, following Brazil, Chile. So, but at the end, with great surprise, some big countries like Mexico and Bahamas that is putting less than 2% of its GDP to face this virus. We need to understand here also that between Peru and Brazil, even though Peru is putting 12% of the GDP, Brazil is a larger country. So the revenue in Brazil is higher. So maybe this 10% is higher than Peru. And also, we need to think about that Brazil has some experience facing some populational diseases like the dengue, and they have some better infrastructure in research to try to go faster to find a vaccine or try to look for another vaccine or medicine that can help to prevent the number of deaths in its country. In this context, we need to think about the countries putting in place two types of policies. First, they need to start to look for population and incentivize the social isolation. People in Latin America and Caribbean need to isolate. They need to do simple things like using masks and try to protect themselves and try to protect the others. And governments need to work and start to think about seriously about to create new capabilities and buy some resources that are so critical to face this disease. One of the risks in Latin America and the Caribbean countries in this pandemic is the global demand and supply for medical goods. As we see, every country in the world are looking for new providers to catch these respirators, masks, and protective wear. Every of the patients from COVID-19 that are infected, they need to be treated in special units. And these units need respirators to treat this patient and prevent from the death. So we have a high demand of basics and critical supplies, not only from the health sector, but also for consumers, and actually for governments that are thinking about the second outbreak. What it means? Means that governments from developed nations like the United States, the European Union, Asian countries are starting to buy in high quantities these products. And what is happening in the global market? When a buyer has to decide between sell their products to a developed nation or a developing country, they in most part of the time decide to sell developed nations since they have more money to pay it and they buy in high quantities. So developing nations in Latin America and Caribbean are in high risk of not to be able to buy these critical suppliers. What are the consequences? Like I said before, developing countries cannot rely in the external markets to buy these products and try to build strong capabilities. We cannot compete with the purchasing power of developing nations. What is the second risk? That also there are some domestic policies in these developed nations that are affecting the developing countries. For instance, the Defense Protection Act in the United States is encouraging and requesting firms in the United States between the borders to increase supply of these critical goods for the health sector, but also sell these goods to the government first before they try to sell it to the international community. So supplies is we are creating shortage. And there is some kind of research about this topic. They say that when a country starts to put export restrictions, which mean they don't allow the firms, the private sector, to sell the suppliers to the international market, there exists a multiplier effect. What happened? If the United States start to put this kind of export restriction, probably China will also do that, and also the European Union. And we need to understand that there are these countries who produce this kind of critical goods. So is the United States, is China, is Germany that produce the respirators, is China that produce the massive number of masks and protective wear for our doctors. So developing nations have not the capacity to change and say, okay, it is happening in the United States, there is an export restriction, so I will choose China. No, we don't have the capacity to substitute imports. We don't have the capacity to go against these domestic policies. So we are facing a context that is not so good for developing nations, including Latin America and the Caribbean. Here there is an example about these policies and how they affect developing nations. Here, for instance, medical products were banned to enter to places like the Bahamas, Barbados, because export bans. And this is happening. And not only is happening from developed nations to developing countries, it is happening between economic blocs. For instance, in the European Union, Germany had blocked some of the export to members of the European Union. So this is a really situation where these tendencies of first take care about the national citizens is increasing. So we really need to think about how we need to be prepared from our second outbreak or for future pandemics. So what countries in Latin America and the Caribbean can do right now? We see a high uncertainty about our suppliers, from the most basic and cheapest goods from the medical sector, like masks, to the most sophisticated, like the respirators. So, but developing nations also have some capabilities then between their borders. So governments need to start to incentivize or increase economic incentives for these large and small business to start production. For the most basic, give incentives from these small businesses to produce masks in a massive amount and give the population. Give incentives from these small businesses that are innovating, trying to construct ventilators with some national insumes. Even though the quantity will be no higher, 10 ventilators in Peru or in Brazil or in the Caribbean, in Nicaragua, makes so much difference. So give increased incentives for these people to start to produce between their borders. Also, we need to think about maybe it's a good time to start to negotiate better with our strategic trading partners. China is the second largest partner from Latin America. So China has a massive supply of these goods. So it's time that developing nations in Latin America and the Caribbean start to try to negotiate better how their main trading partners can help to face COVID-19 right now. Importantly is education. Right now the government have the responsibility and also have the power to establish clear rules to increase education using the public media. Education about COVID-19, starting for what is the virus, what are the consequences, and be sincere, telling the population that we don't know how to face the COVID, it's really important. Governments are telling the population that staying at home is the solution, but this isn't true. Governments need to be clear that we don't know so much about the COVID, and that is why people need to take prevention. Starting to using masks when go outside, and starting to think about what they can do to protect better when they are at home. Economic aid for households, it's really important in Latin America. Remember, when we talk about Latin America and the Caribbean countries, we are talking about nations that has inequality. We have regions that are so divergent. Regions between the countries are so poor. So these economic aids, in most part of the time, are not achieving the people that they want to achieve. People that is poor have no credit accounts to go and receive the aid that the government is giving. We need to think about another solutions to really reach these people that is needing this money right now. More than 40% of people in Latin America work in the informal sector, which means that they need to work to live in the daily basis. So we need to think about how these people in the informal sector can really benefit for these economic aids. And also we need to think about seriously about how we can help also the large number of immigrants that are moving to these places and also have no resources to face this crisis. So the government needs to start right now, create groups and try to face and think about how we can improve these situations. In the long run, it's time for Latin American countries to think about the specific feature of the countries. In Latin America and the Caribbean, we focus so much in concentration of sectors production. We rely in commodities prices, we rely in raw materials, we rely in tourism, but few about manufacture. We need to think about how Latin America will be affected in terms of economic growth. For instance, between Latin America and the Caribbean countries, there are so many countries that are suffering from recession. They are right now suffering economic crisis, like Argentina, high inflation, like Venezuela. Brazil, that was starting to grow again, is facing recession. So we need to understand the impact of neighbor countries in specific countries. How this COVID-19, how this slow economic growth, how exports will be affected with our main trade partners in the world or in the neighbor region. External factors are so important. We need to think about how COVID-19 is affecting Europe, the United States, and China, and what are the negative spillover about that. China is not growing quickly like before. So China is the second trading partner of Latin America, which means that exports from Latin America to China will reduce, similarly to the United States, similarly to Europe. Also, we need to think about that governments in Latin America can see the COVID-19 also like an opportunity to cooperate. As we can see, the COVID-19 virus spread is asymmetric, which means if you see the picture, you see that the COVID-19 is more concentrated in specific countries like Brazil, Peru, and Ecuador. Why not think about international cooperation? Why not to think about some plan to join forces and try to help these nations to face the COVID-19 and recover? We need to understand that the COVID-19 don't respect borders. So even though one nation put all the efforts and don't have numbers of infected, it doesn't mean that they will not suffer from a second outbreak. The virus is spreading in the world, so cooperation is key. We cannot think about protect our borders only. We need to think about, like in the big picture, the worlds need to face COVID-19 together. The virus is here. We need to do something to eliminate it, or less, try to understand better the virus, create vaccines, create in a large mass production, and help these developing nations to be better, to face and reduce the number of infections there. One of the possibilities to work on that is think seriously about multilateral agreements in the region. Latin American and Caribbean countries need or can think about joint efforts and help specific nations where the virus is so much concentrated. And also, this can be a new opportunity to really understand what are the most important actions that the government need to take to increase or incentivize the rising of new businesses in the countries. For instance, we can start to think about the relevance of have a manufacturing sector that is producing these essential goods from the health sector between our borders. Try to use the revenues from the extractive sector, from the export of soybean, from the export of metals, and try to use this revenue and start to create new sectors of production, manufacturing, or trying to create more research and development to try to better understand this kind of virus. We need to understand that the COVID-19 is one of many of viruses that the world will be suffering. We are living in an interconnected world, which means we trade goods and people like viruses are traveling fastly. So probably, like Hannah, one of the authors say, probably COVID-19 will be the first of so many other pandemics that the world will see. So we need to take action right now. Worse is the expectation of the economic growth that the IMF is projecting from the region. He says that the economy in Latin America will contract to less than 5.2%. And he is asking about, and he is trying to say that it will be a time from economic nations in Latin America and the Caribbean country will not be able to grow, where unemployment will be increased, where poverty will increase, because so many resources are used today. And these nations, again, are strong. They really need the exports, the revenue from export to the main trade partners. So it's a really complicated situation right now. We need to think about what will be the actions of the governments to better face this recession in the following years. All countries will be in recession. What we can do to better face this situation. So to end, I would like to say that here in this context, the most important thing that we need to think about is cooperation. Cooperation starting from between the borders of each country, each city need to think about that protecting itself help to protect the country. And again, in the region, protect Brazil means to protect the region. And again, if I protect the region, it means that I am helping the world to protect from the virus. Cooperation is key. Developed and developing nations need to work together to face COVID-19 and other pandemics. But we need to understand that with COVID-19, we are learning so much how to face new pandemics in the future. So we need to start to think about what kind of business we want to develop in these nations, what are the actions of prevention, what are the education that we need to do our citizens to better face this pandemic, and what are the economic policies that we need to use in this kind of situation. As well, thinking about the international community, how these new multilateral agreements can better help the countries to face COVID-19 and other outbreaks in the future. Well, this is the reference if you want more information about these topics. And please, I invite you to look for them. They are really good references. And thank you so much for your time, your help. And please let me know if you have any questions to start the discussion.
Yes, hi. My question was, how can you cooperate with Brazil, considering that President Bolsonaro doesn't believe in, you know, social isolation? Basically, he doesn't believe in the virus.
Oh, this is a really tough question, but maybe we can cooperate with them when the countries, with all of the neighbor countries, explain them what means from them that Brazil don't take actions. Remember that we have several multilateral agreements. So nations need to protect themselves from the virus. If Brazil is not taking action, they can maybe try to persuade the government that if don't understand COVID-19, it can be bad from future trade agreements. You know, the world is connected, so maybe trade agreements is a good form to persuade President Bolsonaro to take better actions.
Okay, thanks.
Yeah, I think in that one also, the states, you have governors in Brazil that in different states that are actually taking action, even though Bolsonaro is trying to revert some of their decisions. So that might be a way to collaborate, is to actually go and try to collaborate with some of the governors and local governments in Brazil. That might actually work a little bit better than with Bolsonaro right now. My opinion anyways.
Mm-hmm.
I would jump in too and say that I think even in the United States, the response by local governments has also kind of shown how beneficial it could be to not necessarily go around the federal government, but work with local governments and also private businesses and taking measures to do social distancing, create PPE, and other things like that as well.
I agree with your response also. Yeah.
Got a question.
Here we have. Yes, please.
I was looking at the data for Brazil and some other countries, Mexico, and while the numbers keep going up, they're going up at a relatively small rate for such a big country. About 400 infections per day have increased, and the deaths are at 30 or 40 a day. To me, that's been quite surprising, given what Bolsonaro and AMLO's responses has been. Do you know anything about the projections, or are people, to what degree are people socially isolating in spite of those presidents' unwillingness to impose more stringent social isolating policies?
Well, thinking about Latin American features, I think it depends so much about the regions. For instance, if you think about Brazil, you have a large population of people that live between favelas, neighborhoods where people shared small spaces to live. And also think about the number of childs that each family has in Latin America. We have a large population. It's a little difficult to try to isolate. But most importantly, also education. When you don't know about what is the COVID-19, that is more probable in people in poverty, like in Latin America, in these specific regions, it's complicated to really persuade them to isolate.
I very much agree with you. And so I'm quite surprised that the outbreak has not been much worse in both Mexico and Brazil and other countries for exactly the reasons you're mentioning. People live very close together, and they need to be on the streets, as you said at the beginning, to earn daily income. And so I'm surprised that it has not really advanced much more quickly than it has in those countries.
Yes, and also, for instance, in the case of Nicaragua, we see that the government has different metrics to measure how large is the number of people affected from COVID-19. He's excluding people that pass away from the virus, and is not putting this data in the national data of infected, of people that was harmed from the COVID-19. So we have weaknesses in the way how governments are giving data about the real number of cases. And this is worse when you have a country where regions are completely different. So regions in Peru, for instance, from the south to the north are completely different. So the way how people are facing the COVID-19 is completely different. Some of them go to the doctor to receive treatment. Some of them make an appointment like it's a flu or it's something different, and they are not attended and they dead before. So we really need to be careful about think about the data that developing countries are giving, because I believe that we are not prepared to say this is the exactly number of cases. And more when we see the projection of other countries, that we see that most of 10% of the people infected is dying. So we didn't see that in the reports in Latin America. We need to be very careful about how we can interpret this data and how reliable they are.
Also, can I make a comment?
Yes, please.
For example, in Colombia, most of the people that brought the virus into the country was wealthy people that they were traveling. So I think, and I'm going to post a link for an article that came out today, where they say that the worst for Latin America is going to be in May. And I think it's just going to move down from the wealthy people to the people that work for them, and it's going to spread faster. My family is in Colombia, so to me it's personal. And you see like who's getting sick now. So I think Latin America and maybe Africa and some other parts are not yet there because people can travel, or other people are not there yet with the virus. So I have a feeling May is going to be key for this. And I'm going to post the link. But I don't know if anyone else has an opinion on that. But I think it has not spread faster because in Colombia, the two people were one in Italy and one in Spain. And that's how it started more or less. So.
Hey, Luz, hear me?
Yes.
I actually just wrote a paper about that for Panoramas on COVID as like a class issue that will probably be published next week. But I completely agree. I think once once it kind of spreads to lower class, you're going to see a much higher spread, like a rate of spread, much faster, because there's less ability to quarantine. Yeah, I think this is just like a really interesting issue, and I think the way the governments are responding, especially with Bolsonaro in Brazil, is very dangerous for the future.
Yes, complementing your point, as we can see, governments need to start to think about different policies. For instance, trade. Like if you think about some countries in Latin America, they rely on tourism. So we have a large flow of people from outside that generate economics from developing nations. So it is not so much about who carry the virus and spread it, but it is a little bit more about how we can protect better the citizens, or how these multilateral agreements that are growing in the world can also contribute to try to reduce this kind of outbreaks, maybe increasing some rules for companies to take care more about the health products, how they manufacture these products, what are the conditions of the workers that are manufacturing these products, since these products travel from around the world. So organizations like the World Trade Organizations that are encouraging trade between nations, between developing and developing countries, need also think about how they can help to prevent future outbreaks.
Marilu, in Brazil, the population makes a strong comparison of dengue with COVID-19, the cause of death. What is your perception? There are some studies that show that dengue produces more deaths than COVID-19.
Well, I don't know exactly if there is some association between this data, but we need to understand really important difference between dengue and COVID-19. Brazil and many countries in Latin America are facing dengue. We have more information about the dengue than we have about COVID-19. We have some research, we have some tests. The dengue is being studied for years, but from COVID-19 we don't have, or we don't know so much. So I believe we need to be careful to compare about the how, or what is the number of deaths between people suffering from dengue from people that are suffering from COVID-19. Many people is confused, so they don't know that they have COVID-19 and they think that is flu. And another people that die for complication in the lungs. That can be COVID-19, but nobody asks about that, or nobody has the interest to go deeper and see if these deaths are related to the virus. As I said before, we don't know about so much the virus, and new studies are associating the virus with some effects in the brain. So it's a new issue. We cannot do these comparisons arbitrary. We need to be really careful and understand this is a new virus. We don't know so much about that.
Thank you.
So just to mention a little bit about in terms of Brazil, one of the problems, just addressing something that Scott was asking about the numbers and everything, Brazil has actually, because of the federal government not being very supportive, the testing has also been extremely behind. If you look at all the top 15 countries that have the top number of cases. Brazil is up there, but the number of testing, we are way behind in comparison to the other countries. So that might be one of the reasons that some of the numbers are not quite as bad as we think it is, because it could be actually much worse than it actually is. And it goes back to what Marilu mentioned earlier in terms of what the governments are reporting as well. There might be some cases in Brazil that, and there's suspicions that this is the case, that were not attributed to the COVID-19 that should have been actually investigated to see if it was or not. So whenever you're relying on the governments that are actually responsible for doing this kind of stuff, especially with the president like Bolsonaro, you never know what's actually going to be reported or not.
Well, everyone, someone has another comment, some other question?
Marilu, I have a question. So have you seen any of the countries actually trying to reach out to the other ones to try to make some kind of collaboration and cooperation to try to combat COVID-19 in Latin America or the Caribbean or anything like that?
Yeah, well, at the beginning of the outbreak, countries like Peru, Chile, Colombia, well, it was what the president in Peru said. They try to enter in contact to try to think about some cooperation actions to better face the COVID-19, but we didn't listen so much about that after that. So I think COVID-19 was so much unexpected that it's challenging what the governments were, the initial thoughts of them. And these policies of cooperation maybe go behind because they are trying to face the virus between their borders. But no, I didn't find something that say about a more well-prepared plan for cooperation between these countries. Well, everyone, so since we don't have more questions, I hope this presentation help us to have some thoughts, help our communities or countries with some ideas, try to spread information with people in different countries, and try to persuade the governments by maybe sending a message in the Twitters about present some real data about what are they doing to face COVID-19, but present some data. Data is key. So I really want to say thank you for joining Panorama Roundtable. Thank you for your time. I hope you all are well in their homes, and we hope to see you in the next roundtables that we are preparing. So see you and take care of yourself and have a great weekend.